Pain psychology is not the when everything else fails intervention because you just must be crazy. No, like it's really meant to be a first line treatment.
So 90 to 93% of people go to an average around 17 sessions of physical therapy after an ACL repair reconstruction. And that's good, you should definitely do that. But I would be absolutely flabbergasted if the numbers were anywhere close to that for people seeking out some sort of mental health care or therapy after some sort of major life trauma or divorce or even just a major breakup. And I guess the reason I'm even comparing an ACL to some sort of psychological trauma is that I think there's a big discrepancy of how we conceptualize the body versus the mind. I think people tend to bring in their knees or spine to the doctor as if it were a tire or radiator after the check engine light came up to a mechanic. And I mean, this purely mechanical framework can only go so far because a Prius can't experience this. Maybe a Prius can, but a Hummer can. And as a result of this, I think there's an ongoing tendency to neglect what is the most complex organ in the body, the brain that can generate the perception of reality and the universe, by not going to see a mental health care provider, especially regularly. I'm not perfect at this myself by any means. And you might be like, Derek, what you talk about? Therapy is expensive, especially if there's any insurance issues. It's time consuming. It's hard to find a good therapist, especially a well-trained one. Well, I'm just hoping that the more we can send out messages like this, the more we can chip away and wear away at the barriers of this very complex healthcare system in order to get people to see mental health care providers. Anyways, listen to Dr. Meints discuss how to find a good mental health care provider for pain. And if you're going through it right now, I strongly encourage you to find someone that can help take care of more than just the body when it comes to pain. Because as one of my attendings used to say, when the eyes don't cry, the body does.
So you want somebody who is trained in health psychology or behavioral medicine or has worked with populations who have chronic illness. You want to make sure that they have training in evidence-based practices. If you have a history of trauma, I would highly recommend making sure that the person has a trauma-informed approach. You can check the APA directory, so American Psychological Association. Where I usually go, there's a website called psychologytoday.com. You put in this. Nowadays, I usually just do state because most people want virtual. So the state you're looking for, whether it's in person or online, you can put in your insurance information and then your chief areas of complaint. So they have chronic health and chronic pain as one of those. You can identify male or female if that's important, and really get an idea of who these folks are, to be able to see if they might be somebody that you could work with.